Aerosol generating procedures release airborne particles and droplets that can increase the risk of respiratory infections. We are all too familiar with the health and safety measures currently in place to combat COVID-19. It's not unusual for us to feel anxious when visiting the dentist. However, this is heightened during COVID-19 as we deal with our existing anxiety coupled with the threat of COVID-19 while receiving necessary dental treatments. Simple procedures such as dental checkups can expose the dentist to over 600 different types of bacteria in any one person's mouth. Dentists are exposed to diseases, viruses, and bacteria during everyday procedures. Safety is of top priority in dental offices. I went out and asked the local dental nurse about all the safety requirements implemented in her practice.
Yeah, so if you have an appointment, you can't come in and wait in the building. You have to ring in and the girls on the desk ask you the questions if you have COVID or you've been in close contact with anyone that has had COVID or if you have any symptoms. And then you're asked to stay in your car until we're ready for you. And then the patient that's in the chair leaves, we clean down, we wait about 5 to 10 minutes, and then we phone the next patient. Before a patient enters the room, I ensure that I'm wearing all the correct PPE. I start off with my N95 disposable mask and then my surgical mask over it. I don't need protective goggles as my own glasses protect my eyes as it is. I put on a hairnet to stop me from touching my hair, which then prevents the transfer of bacteria. I put on non-latex gloves, which also protect any wounds or openings on my skin. I finish off by putting on my protective overalls. After each patient leaves, I dispose of all my PPE in the clinical waste. I replace both of my masks, hairnet and gloves. After each patient, I ensure to wipe down every surface with antibacterial wipes or spray.
As previously demonstrated, PPE is extensively used in dental surgeries, but on the hierarchy of controls against COVID-19, PPE is listed as the least effective, whereas elimination of COVID-19 is listed as most effective.
Even though we take all the required precautions and use all the correct PPE, dentists and nurses may not be comfortable in the workplace due to the risk of COVID-19. For instance, we had 2 dentists who never returned to work because they felt that the PPE wasn't sufficient and didn't want to take the risk of contracting COVID-19.